Hey there, Dr. Fedich here, Village Family Clinic, coming with you another weekly educational video here. Talking about two things today, really interesting stuff about chiropractic and your health. First thing is our tip of the iceberg diagram here. So you've probably all seen this in one way or other. People use it a lot to describe a lot of things. But as far as chiropractic goes, up top of the iceberg here is your pain and symptoms. All right, so the tip of the iceberg is just the pain and symptoms you're feeling. You see the whole problem is there below. So we've all been to the dentist. That just finds small cavities. Sometimes it doesn't even hurt, and then you might have a problem there. And sometimes even if it is hurting, the dentist, you just see that little bit or a little bit of pain. Underneath, there's a whole lot of rot in there. And the same thing happens with your spine a lot. So you got the vertebrae in here, 26 pairs. These vertebrae get out of place, they can pinch, choke, rub, or irritate those nerves. And that nerve supply can affect all sorts of different things. So I'll have patients getting better from digestive problems, allergies, sinuses, other things not related to that pain. So that pain is just a little tip of the iceberg of the whole problem. So it's really important everyone should get chiropractic care regularly. Make sure all those nerve channels are open and flowing, able to communicate to the whole body all the time. Along those other lines, there's actually a little bit older study that I want to talk to you about today. It's really famous in natural healthcare chiropractic. It's called the Windsor Autopsy Reports. It's a pretty famous study done in 1921. So it was actually a Harvard-trained medical doctor was interested in what chiropractors were saying. I'll read you some of what he said. So, chiropractors claim by adjusting one vertebrae, they can relieve stomach troubles, ulcers, adjusting another menstrual cramps, and others, they can help with issues like kidney, constipations, heart disease, thyroid, and lung problems. But how can they do this? So this doctor, instead of just saying chiropractic didn't work or that sounded kind of nuts, he went and investigated it all. So he got through medical school and went to study cadavers. He wanted to see if there's any connection between the curvatures of the spine and these diseased organs. So he took a bunch of cadavers. There was 221 cadavers that they looked at. 221 cadavers they looked at, 212 of them had, or 221, they found the cause of death. Now, those 221 cadavers that he studied, 212 of them had a nerve problem corresponding to the organ that had a problem. So basically what they found was wherever say they found the organ to the lung and the person died from a lung condition, they traced that nerve back where it came out of the spine. It had a 212 out of the 221 bodies that they examined, that nerve was being pinched in the spine. And I'll go through that a little bit more in just a second there. So almost all of them they find. And some of he has his findings. This is well-known published research. Stomach, there was 9 people that had stomach problems they passed away for. All 9, they found a problem with the nerves between T5 and T9, which is the middle back nerves correspond there. 26 people with lung problems. All 26 had misalignments in their upper spine corresponding to the lungs. There was 13 cases which had a liver problem. They all had a problem with their middle back where those nerve organs come from. 5 with gallstones. They had a problem with the same nerve that went to the gallstones. 3 with the pancreas. 11 in the spleen. There were 17 cases of spleen problems. All of them had dysfunction where the nerves come that go to the spleen out of the mid to lower back. Prostate bladder stuff. So we'll sometimes talk about prostate stuff and men's and women's health down there. All 8 cases had problems there. The uterus. So we're talking about sometimes about helping women get pregnant. People made jokes about that. The 2 cases with uterus problems that had their L2 or second lumbar vertebrae had a problem. And there were 20 cases of heart problems. So one of the more common causes of death. They had upper 5 thoracic vertebrae, T1 through T5 were misaligned. So this is a groundbreaking study published in the Medical Times. And it's in every single medical library findings has since been confirmed by several other big studies. So what they found is almost every cadaver that they looked at, wherever the diseased organ was, they could trace back that nerve and find a bone out of place pinching the nerve there. So a lot of times, if you pinch a nerve in your neck, a lot of times we'll get hand pain, arm pain. We kind of all understand that. Sciatica is one of the most common conditions we'll treat here that doctors see. And we all know that, well, not all know, but most people know that comes from a pinched nerve in the back most of the times. So those are more common, but what they found is you pinch a nerve to the spleen, sometimes we're finding spleen problems, right? You pinch a nerve to the lung, we could have lung problems, asthma, allergies, sinus, that stuff. So that's why it's important to get checked regularly, even if you're not having any kind of problems. These misalignments happen slowly. One way of telling people over the years, if you imagine my hand and this hand, you're not, I don't feel that other hand, right? Now I still don't feel it, still don't feel it, still don't feel it until I touch it. Now I feel it. So these problems build until it's compressing the nerve enough to feel it. Another thing with chiropractic, the opposite's also true. I'll tell patients, if we take just a tiny pressure up there, I don't feel that anymore, right? My left hand doesn't feel the right. but we really want to make sure we're separating, keeping those nerve channels as open as possible. So that's why it's really important to maintain your spinal health. Keep those nerve channels open as much as possible so that these problems don't stir underneath and end up causing some bigger problems. So if you're anyone you know is looking to keep better track of their spine, better health, it's great to go to the chiropractor on a regular basis and make sure their nerve channels are open and free and working as best as possible.